Hello, my name is Mark Rothstein. Welcome to my latest short video on public health. Today's topic is, do vaccines cause autism? Once again, I want to start with my usual disclaimer. I'm not a physician, and nothing I say should be considered medical advice. I'm not an epidemiologist, a virologist, or other type of scientist. My background is in medical and public health ethics, law, and policy. And for the last 25 years, I've been a faculty member at schools of medicine and public health. And I served as associate editor for public health ethics and law of the American Journal of Public Health. This video is being recorded on November 30th, 2025. I want to address three important questions today that many people have had about the recent CDC policy change regarding vaccines and autism. First, what is the reason for the change? Second, how have leading medical organizations responded? And third, what are the public health implications? I'd like to begin with some background that's, I think, is very important here. As most of you know, the development of safe and effective vaccines has been one of the greatest achievements of modern medicine and public health. Highly contagious and deadly diseases such as smallpox and polio used to cause the deaths of millions of children and adults. Vaccines greatly reduced the severity and number of cases, and several of the deadliest diseases have been eliminated. I think one of the reasons some people claim that vaccines are unnecessary now is that it has been so many years since people have personally witnessed the horrors of these vaccine preventable diseases. In 1998, an article on vaccines and autism was published in a medical journal by an author who was paid to write it and had a financial conflict of interest. The article claimed common childhood vaccines, notably the commonly used measles, mumps, and rubella vaccine, caused autism. A subsequent investigation, however, discovered that the study was totally fraudulent, and the data underlying the study were absolutely fabricated or made up. The medical journal retracted the article, and the physician author lost his medical license. These are extraordinary measures indicating the severity of the misconduct and the negative consequences of the publication. Since publication of this article in 1998, independent vaccine research has been conducted in 7 countries involving more than 5.6 million people. The conclusion from every one of these studies is that there is no link between vaccines and autism. Myths and false information tend to linger in the public consciousness when they support deeply held beliefs of outspoken individuals. There were previous claims about supposed associations between childhood vaccines and arthritis, ADHD, diabetes, infertility, multiple sclerosis, and other serious health conditions. Therefore, it's not surprising that a thoroughly discredited study about vaccines and autism has continued to be relied on by individuals and groups opposed to childhood vaccination. One of the arguments used by vaccine opponents with regard to autism is that the number of autism cases has risen substantially in recent years. The number of cases of autism have risen in recent years, but there's another explanation. In 2013, the leading diagnostic manual for physicians, called DSM-5, changed the definition of autism. Instead of limiting the diagnosis to severe cases, it merged the autism definition with diagnoses of several related, less severe conditions to create what is now called autism spectrum disorder. The new definition emphasizes that these related conditions have a wide range of severity. Although the total number of cases has steadily increased with this new definition, the most severe cases have increased only slightly. Another reason for the overall increase is that there are better diagnostic tools and more people are aware of this condition and have their children tested so that their educational programs at school will be more appropriate. For decades, the CDC unequivocally followed the conclusion of the experts that there is no link between autism and vaccines. On November 19th, 2025, however, the CDC removed its prior statement from the website and replaced it with one that says the evidence that vaccines do not cause autism is, quote, inconclusive, and called for more studies. The change to CDC's website caused significant concern that many people now would doubt the safety and efficacy of medically necessary and appropriate vaccinations of their children. Therefore, numerous leading medical organizations immediately voiced their vehement opposition to this change of policy by CDC. Here are two leading examples of responses that have come out just in the last few days. First, from the American Medical Association. Despite recent changes to the CDC website, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism. Extensive and rigorous studies consistently show that vaccines are safe and effective at protecting against serious illness. Vaccination is essential to protect individuals and communities from preventable diseases, making it a fundamental element of public health. The AMA is deeply concerned that perpetuating misleading claims on vaccines will lead to further confusion, distrust, and ultimately dangerous consequences for individuals and public health. Another comment was submitted by the American Academy of Pediatrics. The conclusion is clear and unambiguous. There's no link between vaccines and autism. The American Academy of Pediatrics stands with members of the autism community who have asked for support in stopping this rumor from spreading any further. I think the vaccines and autism debate should be viewed in the overall context of vaccines and public health. As I mentioned in an earlier video on COVID, the US has 4% of the world's population, but 17% of the world's deaths from COVID, despite unsurpassed medical capability to prevent, diagnose, and treat the disease. What accounts for this? Well, largely because of misinformation. Only 70% of adults received any COVID vaccine, resulting in the unnecessary deaths of over 330,000 people in the US. Another 48,000 people died because they refused to take Paxlovid after diagnosis, preferring to take nothing or discredited remedies. Refusing to vaccinate children due to CDC misinformation, characterizing as inconclusive the established fact that vaccines do not cause autism, could also lead to widespread illness and death among children. According to the American Public Health Association, quote, the false rumor that vaccines cause autism distracts from pressing urgent issues in children's health. Amplifying this claim and encouraging unnecessary investigations only worsens parents' fears. It will not lead to better therapies, improved support for caregiving families, or changes in healthcare, education, and society in ways that would help children with autism thrive. I want to mention another recent development that is also of great concern. On November 28th, 2025, only 2 days before I am recording this message, the FDA distributed a memo claiming that no fewer than 10 children died as a result of receiving the COVID vaccine. Because of this, the FDA said it would revise its COVID vaccine rules for children. It didn't specify what it was going to do, but presumably it would issue a warning with the vaccine or otherwise discouraging children from receiving the vaccine. Few details were provided about how the study was conducted, such as the ages of the children and whether they had other serious health conditions at the time. The study also was not subject to peer review and was not published in a scientific journal, as is standard procedure, especially for such an important scientific publication. Even assuming this study is correct, that is, the number of 10 deaths is correct, it should be kept in mind that children in the US safely received over 100 million doses of COVID vaccine and prevented numerous deaths and serious illnesses in children. It is difficult to avoid concluding that the FDA memo was intended to justify actions consistent with the anti-vaccine philosophy of the current leadership of the Department of Health and Human Services. I deeply regret that the CDC, FDA, and HHS have been willing to disregard overwhelming scientific evidence and rely on misinformation to support reckless policies in support of an ideology that endangers public health. More than ever, it is important for parents and all people concerned about their personal and community health to rely only on trustworthy sources of medical and public health information. A good starting point is to trust your own physicians and other credible sources with a history of providing accurate and valuable information. I hope this brief update on vaccines and autism has been helpful to you. As always, I send my best wishes for your good health and well-being.